I'm Kenna, and this is my 2.5-year follow-up visit. And the update in 2.5 years is I've come a very long way from my initial consultation. When I first arrived, if you look at my original video, I had been diagnosed with dozens of different conditions, one being dysautonomia, which is the one that put my life in jeopardy, and fibrocystic breast disease, as well as POTS, and I had severe migraine headaches that I suffered from a regular basis for sometimes weeks and months at a time. Digestive disorders, and just going into organ failure in itself posed a lot of different difficulties as far as not being able to eat or walk or speak or do things that a normal person would do. So since that time of coming here 2.5 years ago, I've regained much of myself back. I can now eat, which is exciting, and I've been able to function a lot more at a higher level. Even though I am fragile, I am completely stable. And I love how Dr. Jati has described me coming together. He's described me as being like a china teacup that's been shattered, and that he's given me all my pieces back, and he's restored me back to my teacup. But you would treat the teacup, you would handle it with care. So that's how I have to live my life now, is I handle it with care, but I feel so blessed to have my life back. So if you had seen my first video, you would have seen how dire the state that I was in when I arrived to Dr. Jati. We had to move back from North Carolina, which is where our hearts are and where we had established our lives together, and we're very much involved in a volunteer work, which means everything to us. And we had to leave because I was dying. I was completely bedridden, and as my father would put it, I had come home to California to die. And that's how I felt. And now, 3.5 years later, through consistent treatment, lots of love and support from the doctors Jati, I've come to the point, my husband and I, where I've made so much progress that we can now return to North Carolina and continue to live our goals and to enjoy life there and to pick up where we left off with our volunteer work. And that means the world to us, to have come this far. And when we left, there was never a thought in our mind that we could ever achieve or even go back. That was never even a thought in our mind. We were just heartbroken that we had to leave such an incredible privilege of being there. So I'm happy to say that after this time, and after much determination and putting work into doing the things that Dr. Jati recommends for us to do, that I've come this far to be able to enjoy life again, to the point of returning to something that's so very dear to our hearts. So initially when I came in, I was in intensive treatment. I needed to be in intensive treatment, which was every day, all day long, and I was in intensive for, I'd say, almost 2 months, because I was in organ failure, and Dr. Jati systematically brought me out of organ failure so that he could integrate the brain with the organs. And then the visits started becoming more spaced out. I would come in 4 days a week, or then 3 days a week, then 2, and then 1, and then eventually it was every other week, down to the point where I was at once a month, and now I'm gonna go longer. So that shows the progression of the improvement of such a, as Dr. Jati calls it, a wicked dysfunction. Autonomic dysfunctions are wicked and they're hard, but despite how difficult they are, how much progress I've made to the point of not needing to be in treatment every day still. So to me, that's successful. So anyway, how he's stuck by me, and he's been by my side, and he's lived up to his word by being there for me anytime, any day, and to answer my questions and to walk me through any times that I've been stuck with needing help with my applications or questions or little things that have surfaced with my body. So for that, I'm deeply grateful, and feel such a heart connection to him, as well as Dr. Tina, for always being there for us, and how much we appreciate them.